I start with one such contribution in the field of memory, and that's Brenda Milner. And we know her work has kind of established benchmark for memory research and classification and typing of memory, which is so important for us. Well, you could approach memory from a systems point of view as being inbuilt memory, which is the implicit memory, or an explicit memory, which you really need to memorize. And this explicit memory could again be episodic or semantic. And the implicit memory, of course, is what we're quite used to. When you learn to swim, you learn to swim. You won't forget it. When you learn to drive, you learn to drive. You won't forget it. And it involves different parts. But the explicit memory, especially the episodic and to some extent the semantic, uh, is important to us because when we're looking at people with epilepsy in whom we want to intervene, we really need to be sure that the intervention is not going to produce a deficit, whether it's the drugs, whether it's the surgery, whether it's the modulation we do. The patient shouldn't have more harm than benefit. And using that as a premise and the lattice of work which has been done by her, we refer our patients for a neuropsychological evaluation, particularly in the pre-surgical, as a pre-surgical tool for lateralizing and telling us, the psychologist needs to tell us, that is there a balance of remaining functions on the side which we are not going to intervene. That is the patient having capable resources on the non-intervention side? And the commonest surgery, and of course, the one which has been extensively investigated in class 1 trials, is the temporal lobe epilepsy. And we know that verbal memory is kind of lateralized mostly to the left temporal and hippocampal circuits, and the visual memory is towards the right temporal circuits. So basically, we want our neuropsychologists to tease out these. They could do it in several ways, and there could be a case 1 which has a right mesial temporal sclerosis, and there could be a case 2 which has a left mesial temporal sclerosis. And there would be several tests which they would do, and the commonly used one is the auditory verbal learning test, where a list of items is given and they're asked to do an immediate recall, a 20-minute recall, and even recognize the words which are in that. And the visual memory is tested by the ray ostrich figure test. These are pretty uniform, and they would show differences in the right versus left. You would expect a worse verbal memory in the left mesial temporal, and you would expect a worse visual memory in the right temporal. But you would want your psychologist to tell you that there is an adequate visual memory in a patient who's going to undergo left temporal resection. There are various ways by which they analyze it. They do the ray ostrich figure. Mind you, even I may fail on that figure. It's so complex, but patients, they do it. And they come through and they get cleared for surgery. Of late, of course, there has been an interest in the non-clinical tools. And WADA test was one which was used extensively, but functional MRIs come up in a big way. And it's a test which is basically holding the principle of blood oxygen level dependent changes which happen, where there is a neurovascular coupling based on activity which we do in the brain. So when exposed to the task, the patient will, which here is a memory task or the language task or whatever, will have a neurovascular coupling, and there will be a hemodynamic response produced to this, which will be picked up by the functional MRI. There are several clinical applications of functional MRI. People have used it as a tool to study seizure epileptiform discharges, so fMRI EEG, the marriage of the two. But in this particular context of debate, we are going to look at a mapping of memory, particularly verbal memory. It's been used for language, it's been used for vision, it's been used for motor functions. So it's basically helping us define eloquent cortices. It's very easy to do, it's non-invasive, the patient lies in the fMRI scanner, it's presented with pleasant pictures or words, and then looks at these and replies. And there are different kind of materials. At our center, we use a response pad, we use the headphones for the verbal, we use Hindi battery, which is our mother tongue, and of course we have various various tools, wordless generation, picture recognition. She's a very famous actress in India, and sceneries and word recall tasks. And the tasks are given on and off, and they're standardized for that particular center. Now, all the action in functional MRI starts after the obtaining of data, and that's where you need a very good PhD or someone who's going to do all your motion correction, fusion with the MRI, smoothing, and generate the output on functional MRI. There are several papers which have compared it, WADA and functional MRI. I'm not going to go into that. That's topic of the debaters to do. Then there are ways by which you can, represent it on the cortex, both the language, the memory, the episodic memory, and the semantic memory, and obtain pretty pictures which will help you localize these functions. Now, just to give you a comparison between the two, I don't mean to take, steal the thunder, but WADA is a test which has been discovered by a phenomenal person. It's semi-invasive. It requires a catheter put inside your groin. And of course, there is paresis which may happen where sodium amyloid is injected. There may be speech arrest. A few deaths have been reported. It's stressful both for the patient and the clinician. It's difficult to repeat. It's time-consuming. It's labor-intensive. It cannot localize speech or any other primary language functions unless there is a thorough battery. And of course, many of these batteries need to be standardized. Many of them are standardized in centers who are doing it. There are variable effects of the circle of Willis because there will be anatomical variations. Functional MRI is non-invasive, is a new tool. However, their standard practices still need to emerge. And there are guidelines which have been issued by the American Academy of Neurology. The level of evidences to the use of these tools, both in language and memory. There are meta-analyses which have been done comparing both